I'd like to welcome you all to Reveal Vitality. I'm Dr. Christopher Davis, and I'm a board-certified interventional cardiologist. I'd like to start by just telling you guys a little bit about Reveal Vitality and why I started Reveal Vitality and what exactly it means for me. I practiced cardiology for about 15 years prior to developing Reveal, and my frustration with some of the medicine that we were practicing revolved around what I call practicing Band-Aid medicine. We were taught to find a disease process and this is the procedure you need, or this is the medication you need, versus actually looking at the underlying root causes of all these issues. And what I've learned over the past 4 years, that it is incredible how the body can heal itself if we allow it to do so. Particularly as we look at COVID-19 and how it has affected us all in many ways, we've learned how important it is for all of us to take good care of our body. I mean, live healthy lifestyles, and that's what Reveal Vitality is all about. It's about actually teaching each and every individual what is appropriate for them. It's about looking under the hood, is what I call it, looking under the hood and actually fixing those portions of that engine that may be broken, as opposed to putting Band-Aids on to actually fix these temporarily. So what I would encourage all of you guys to do, I'm super excited about some of the programs that we're offering at Reveal. From a cardiovascular perspective, I think we offer top-notch cardiovascular risk reduction programs that you're not going to get at other places. With respect to hormone balance and weight loss, again, I think that we'll talk a little bit more about this in other parts of the videos, but we'll talk about the importance of hormone balance and how hormones have been neglected for most people. I think that hormone balance has been somewhat taboo for the most part. However, I see issues with depression and sleep and overall energy levels tremendously get better when we balance the hormones. One of the other things that I think is really important is that when we teach our patients how to take care of themselves, what does healthy look like for you? We've tended to neglect the individual part of that. I'll give examples of, to each of my clients, we talk about, what's the best diet? Is it a high-fat diet, a low-fat diet? Is it a low-carbohydrate diet? Is it a plant-based diet? And at the end of the day, what it boils down to is there's no one diet that's right for anybody. I give this background in that when I first got into the whole integrative medicine space, there were books that I read about the plant-based diet, particularly as a cardiologist. There were books that I read about the paleo diet, and as far as diabetes go, the ketogenic diet. And when I first started our wellness programs, it was kind of a one-size-fits-all. We designed programs that were made for people that certainly would help with diabetes. But what I learned was that we had to be very careful, because diets that were higher in some of these fats were not necessarily the best for everybody. And in fact, the laboratory showed me that after the fact. So what we do here at Reveal, that every client that comes in typically will have some form of genetics to help me know what's best for them with respect to the nutrition that's going to work best for them long term. At Reveal Vitality, we deal with a host of medical issues. Obviously, I said that I was a cardiologist, and we deal with a lot of cardiovascular issues, but the root of cardiovascular problems often involves many other issues, i.e. other endocrine issues, thyroid issues. It may involve gut issues. So one of the problems I think we have in traditional medical practices is that we have specialists that deal with one issue and one issue only, when our bodies are designed to work as a system. So I think it's very important that we actually approach each individual as a complex individual and as a system, and evaluate those things. If you come in with heart disease, then we need to be looking at potential gut issues that may be causing inflammation that's contributing to heart disease. So again, we actually take a more comprehensive look at each and every client when they come in. And I think that more important than any of this, the practice is designed to get to know each client, meaning that we spend an hour, if not longer, with every single client, because in a typical medical practice, the 5 to 7 to 10 minutes maximum maybe, there's no way you can really get to know the patients and really develop a rapport to understand what's really going on with them. And I think that's where the art of medicine has been lost. With Reveal Vitality, you can be assured that your complaints are going to be listened to, because I think that is how we get the results that we get, because we establish that interaction.